Hi there. This is the 77%, the show made for you, Africa's youth. I am Michael Oti. Welcome. So, one day you are feeling happy, but the next you are feeling down. Or do you have friends who are struggling to show up at social events? Depression, anxiety, as well as other mental health issues are on the rise in Africa. So, I thought that today we'll talk about that. Coming up, we'll hear stories of young people who are trying to overcome mental health problems. We'll go to the streets of Zambia to find out why people dealing with mental health problems don't get the help they need. And I'll introduce you to a South African who uses art to confront his traumatic past. To begin today's program, I'll take you to Rwanda. 1 in 6 people in the Central African nation is depressed. In 1994, the country went through a conflict and genocide that led to the death of so many. Although Rwanda has moved on from that dark time, on the surface at least, many still suffer with post-traumatic stress disorder, or PTSD. That is why former beauty queen Amanda Akaliza set up Humeka, an organization that reminds people to take it easy and breathe.
It felt like a weight, just like the water. You're just underneath there and it's a weight over you. You feel physically exhausted, you feel scared. And that to me describes a mental health issue such as depression or anxiety. You feel like you're in the deep end and you're always wondering, will I ever get out? Will I ever be able to breathe again? My name's Amanda Akaliza. I'm currently the president of an NGO. It's called Humeka, which means breathe. The reason I came in with the idea of Humeka was because I started to see my own friends dealing with the things I dealt with and not having the sort of motivation to go seek help. And that's because of lack of education. That's because it was heavily stigmatized.
Okay.
There's 4 ALE students here.
Okay.
So, my name is Amanda Akaliza, and I am the president of Humeka organization. After I graduated from high school, right, I started to struggle with my mental health. It started to decline over time. And it went to a place where I would suffer getting out of bed. I would suffer going to brush my teeth. And I didn't have a reason why. I couldn't explain it, but I'm lucky because I had the space to seek help. But there's so many people who don't have that, right? There's so many people who are suffering and they don't have the space, they don't have the money, they don't have the time, their parents are not listening, right? And so that's what Humeka is about. So we are gonna start with the first activity. Look at yourself in that mirror and remember a time when you were young, when you were in high school, and how that felt like. So we said, okay, we want to create a space where public school students can be able to access mental health care for free. We also noticed that a lot of therapists didn't have interpersonal skills. We are going to give university students the ability to come in and have internships, have interpersonal skill. Part of what's helping me heal is also helping other people.
That's a very long one.
Listen, the thing about mental health is that it is important also for your overall physical well-being. And if you don't take care of your mental health, it could increase your risk of other physical problems like diabetes and heart disease. And I'd be the first to admit that the COVID-19 pandemic was a very stressful time for many people. It is no surprise that mental health problems increased because naturally, many were worried about the future of their jobs and the people that they love. And that is where Pamela Silwana found herself in June 2020. But today, the South African is getting help. Let's check out how she managed to turn the situation around.
For Pamela Silwana, it's a day like any other. The community activist and her mother dish out food to people in their Gugulethu neighborhood near Cape Town. Helping others is her motivation.
It gives us energy because we feel like we give back to the community. But it's also strenuous because of resources. But we keep on going because there's no other way.
Pamela gets things done, but behind the strong facade, the 37-year-old has struggled. In mid-2020, she experienced a mental health breakdown. Pamela clearly remembers the day.
I needed to wake up and everything just felt different. My mind felt like it was scrambled. And every time I wanted to wake up, I don't know, it was just so difficult. Eventually I did wake up, but my hands were numb. And every time I needed to think, my mind just went blank, and I was like, okay, I need to see a doctor.
A doctor diagnosed Pamela with depression, but she's far from alone. More than a quarter of South Africans suffer from probable depression. In fact, health officials have said the country is mired in a deep mental health crisis.
We're a traumatized society, People complain that politicians still blame so much on apartheid, but if you think about it, the structural barriers put in place by apartheid are still very much a reality, and that trauma continues. There's a severe burden of stresses in our country.
For Pamela, employment struggles, childhood trauma, and battling to provide for her 4 children took its toll. But depression has another dark side. Not everyone recognizes it as an illness. Even Pamela's mother had difficulties accepting her diagnosis.
I think it's a lack of knowledge. It will be like witchcraft if people are like that. The people are witched. Even now, people, that's what they believe in.
While it may be tempting to dismiss traditional belief systems, doing so is mostly counterproductive, says Professor Sibeko.
The main thing there is to not dismiss those belief systems. It's actually essential to listen, and then generally when people feel listened to, they're more likely to engage with an alternative perspective once they feel like, oh, you've actually paid attention to me.
Through her activist network, Pamela met therapist Debbie Silver. After receiving counseling, Pamela took a course which has helped her assist others.
I'm more aware where help can be found, and if sometimes the help is not found within my community, then I can organize maybe a transport for that person to actually go get help.
Since her diagnosis over 2 years ago, Pamela has come a long way.
Depression doesn't actually necessarily leave you. I don't know who's gone through depression and actually never has had it again. But I think because of the people that I've been exposed to and the people that I can talk to, I am not in the dark hole, but I'm in a journey. And I now know that my healing journey doesn't have an expiry date.
The thing about depression is that it thrives in silence. And looking at the stories of Pamela and Amanda, they found their healing through helping other people. And that is certainly a point to note. Zambia passed a mental health law in 2019, but its implementation still remains patchy. In this week's street debate, the 77% Fatu Muloshi heads to Lusaka to find out why, despite the law, mental health patients don't really get the help they need.
Anxiety, depression, bipolar disorder, mental health issues like these are seen as taboo topics in many African societies. With limited access to medical healthcare services, young Africans struggling with their mental health are left to their own devices. The DW 77% is in Zambia, precisely Lusaka, to look at this silent epidemic, so-called silent epidemic, and of course talk to the people at the heart of its advocacy. And I'm going to start off with here Mr. Benjamin, who has 10 years experience, of course, talking about mental health. First of all, just give us an overview of the mental health situation here in Zambia.
We have most of our services highly centralized in Lusaka, and we have a number of institutions that are also providing like telephone counseling, just to make sure that access to mental health services is made available, accessible and affordable, even to those who are not within Lusaka.
All right, let me just come to Namatama here. Tell us, what has been your focus?
In the past, people have stuck to these misconceptions about mental health, that mental illness is a curse or, you know, it's demon possession. So my focus has been to debunk those myths and make people realize that mental illness is something that can attack anyone.
And we have Duncan here, who yourself has experienced this live. Talk to us about your experience with mental health. How was that phase of your life like?
I became suicidal at the age of 10, and at the age of 16, I started attempting suicide. I had a migraine headache somewhere at the age of 6, which I developed sores on my lips. You know, sometimes whenever I go to school at home, my friends would laugh at me that because pulse and blood would even come out of my lips. So I received rejection from there, and coming from a broken home as well. So I felt I had low self-esteem. So I sat down and I thought, what's there in the future? And with just the way things were, because we struggled so much in the family when mom and dad separated. We went through so much financially. So there was no any form of hope for me.
What about the family, your immediate surrounding?
So I showed all the signs of suicide to my family, the people that I was living with, but nobody could be able to recognize my mental state. I also could talk much about death and write so much about dying would be the only solution, the only way out. So I showed all those signs. Sometimes I'll talk to maybe spiritual people, but they'll tell me, let's pray about it. So I felt less understood, and I felt the only way out is just to end my life.
I mean, you talked about seeking for spiritual help as well, Duncan. Let me just come to Dr. Francesca here. Tell us, how is the situation of medical access when it comes to treatment services?
Mental health is a health presentation like any other health presentation. Thus, if an individual feels like they've got any mental health issue or condition or problem, they should go to their nearest mental health center.
But is mental health really embedded in your primary healthcare system? This is what the question is.
I think this is something that we're constantly investing in, and I believe this is not something that is unique to Zambia. It's actually a global issue.
But are you now excusing
No,
the situation here because we're trying to move forward?
The answer.
Okay.
A major area that we've started is with primary healthcare is awareness and sensitization.
I will come back to that. Okay. I will come back to what exactly you are doing moving forward. But for now, we've established that there is a problem. Let's talk about that briefly. And please introduce yourself.
Yeah, I'm Abraham Machina. I'm a psychiatrist. What we want to send to the world there and what we want to achieve as Africa, as Zambia, is that we want mental health to be prioritized.
So right now, it is not a priority. Is that what you're saying?
Yeah.
But let me just come back to Dr. Francesca here. I'll come back to you. That he said it is not a priority for this country, mental health.
I will beg to differ. If you compare it maybe to other conditions like HIV, TB, which are well funded, and we have many partners funding that way. So it will make a field of medicine like mental health, which doesn't have many partners, look like it's been neglected.
Okay. I will come back to that later because I am still trying to understand if it's really been prioritized. And I'm going to come to you, Duncan, here. Would you say it has really been prioritized?
I struggled with depression and anxiety for 12 years. I was a young person in school. I never saw anything about mental health on TV. If doctor, you're saying that it's been given that attention, but then why is it like that? Because I feel if I had people that came to my school to talk about mental health, I would have definitely known what I'm struggling with, and I would have reached out and sought for help.
Okay. As an activist, you also have a platform, right? How do you center the communication around mental health?
Okay, so on my radio podcast, I usually include professionals and also people with lived experience. And also, apart from that, we go to schools and communities to also talk about mental health. Please allow me to contribute to the question that you had asked Dr. Walia on whether mental health is a priority. I don't agree. There's a lot of stigma. You'll find that I go in there with a mental health problem and the doctor is actually going to taunt me and laugh at me. And there's also no protection. The police also, make fun of people with mental health issues. And where do you report that to? Nobody takes that seriously, so definitely it's not a priority.
The 2019 Mental Health Act has been passed, right? Which means it's now into law. So, it also has to cater for protection, non-discrimination of people struggling with mental health. But is this a progressive attempt on the side of the government, looking at where you've come from, the other laws that you had?
From my perspective, no. Because some of the things that are in the Mental Health Act are things such as a mental patient should not be discriminated and they shouldn't be called derogatory terms. When you go to the police station and report something, the moment you say you are a mental patient, you get ridiculed. The police don't take those things seriously. It's like these laws have been passed, but they're not being implemented.
I am, for lack of a better word, I'm disappointed to hear that you're devaluing the Mental Health Act to that level. We've been applauded for that Mental Health Act. And that was a huge step for mental health because it protects, it promotes. The same people that you're advocating for.
But what she's saying is it really gaining fruition in terms of the implementation aspect of it? Because if that is not there, then the law is still meaningless.
It is, dear. This mentality of saying government will sort something else alone, it's a wrong attitude and mentality.
Because government is the primary duty bearer.
We hear you, but we are helping with facilitating with policy. We need to understand that. We can't compare mental health to other areas in health right now. Okay. It will be a misnomer.
From the government side, what are you doing towards the issue of mental health now going forward?
There's a lot of training that's coming up for mental health personnel. We're doing a lot of supervisory and mentoring visits when it comes to mental health across the country. Then in terms of sensitization and awareness, top on our priority as well. We're looking into that. Then of course, one other important aspect that I'd like to highlight, we are calling for partners.
Thank you so much. I think we have heard it. What has just been established is that mental health is real. Mental health struggles are real and definitely exist in Zambia as well. I know that it can be too much to do so much, especially when it's supposed to be the work of the government. But as people, what we can do as well is to be more empathetic to one another, show love, show kindness, spread smiles where you can, because you never know what people are going through. This has been the 77% live from Zambia, and thank you so much for watching.
And thank you to Fatu, as well as your wonderful panel for that conversation. If you want to watch a longer version of this debate, head on to our YouTube channel, and you can also find the address right here. Now, lack of funding for mental health problems is not only a Zambian issue. The World Health Organization says that on average, governments in Africa allocate only 50 cents to mental health, and that is way below the $2 per person that is recommended. Fortunately, as we've heard in that debate, there are support groups out there, so seek them out. Recognizing that there is a problem is half the battle won. So how can I tell if someone close to me is dealing with mental health problems? Let's go to Kaz for some tips.
Hello and welcome back. I'm Kaz. Today we will be discussing the what, why, and how of mental health. Mental health is just as important as physical health, and it's important to take care of both. What is mental health? Mental health refers to a person's overall psychological well-being. It includes the way you think, feel, and act in response to different situations. Mental health problems appear to be increasing in importance in Africa, yet there is still a great stigma surrounding mental health challenges. Many African communities view these challenges and disturbances as caused by external factors where people known to be suffering are either bewitched or have evil influences. But this is not true. Problems with mental health are regular health problems like a broken arm or an invisible illness like diabetes. There are many different mental health conditions, and some of the most common include anxiety disorders, depression, bipolar disorder, schizophrenia, eating disorders, and addiction. Symptoms of these conditions can range from mild to severe, and they greatly impact a person's daily life. So how would you know when to reach out for help? If you notice persistent feelings of sadness, hopelessness, or worthlessness, loss of interest in activities that were once enjoyable, difficulty sleeping or sleeping too much, changes in appetite and weight, thoughts of self-harm or suicide. If you or someone you know is struggling with mental health, it's important to reach out for help. Remember, taking care of your mental health is a continuous journey, and seeking help is a sign of strength, not weakness. Thank you for tuning in. We hope this information has been helpful and informative. Until next time, please take care of yourself.
And thanks, Cass, for those tips. On this show, we have talked a lot about anxiety and depression, but remember that mental health disorders come across a wide range. So if you or your friend or a family member has any mental health problems, seek professional help immediately. I cannot stress that enough. Sometimes poor mental health comes from past trauma, like witnessing the death of a loved one or experiencing domestic abuse. And in a society where people are encouraged to suck it up, the unresolved pain hampers your well-being. South African artist Seth Pimentel managed to deal with his demons through his art. Let's find out how.
I've been making art since I was 5 years old. It's been a big part of my life. I don't think I would know who I am without it. So art is me and I am art. It's like medicine for me. My name's Seth Pimentel, aka African Ginger. I'm a contemporary artist, painter, designer, illustrator, multidisciplinary artist. It's well known for creating almost a Pan-African neo-expressionistic art style, combining painting and street art in one style. I grew up in a household where my gran was domestically abused, and I witnessed that a lot as a kid because I was around her all the time. So for me, that was a very traumatic experience. And growing up as a guy, understanding that it's a vicious cycle of unchecked mental health leading to a violent approach, that's just the cycle. And I think knowing is half the battle. And I wanted to be completely aware of, you know, what gender-based violence is and what it's really doing and what causes it, you know. She passed away because of that. I buried it, you know? And that's what made me such an angry teenager. And that's what made me so rebellious, like breaking stuff and just angry at the world, you know? And the older I got, the more I realized that I'm feeling upset because of my own mental health plus my own childhood traumas. What made me vocalize or be aware of my traumas and pain was making art. Healing is painful. It's not the easiest thing, and the only way to be better is to sit with those dark thoughts that you don't want to have and process them. And by doing that, you actually become better and better as time progresses. So yeah, the only thing that made me become conscious of that was making art. I was like, why is my work so dark? Let me do a thorough analysis of myself. And then digging deeper and being like, oh, this was the reason this is so dark is because this is what influenced this approach. Okay, cool. Why did that influence this approach? Well, that happened to me when I was 6. Okay, cool, makes sense. So we're about to head to the Kalashnikov Gallery to check out some of my works and speak to MJ Turpin, the gallery manager. You good? Good. Welcome back. It's good to be back, you know. These are more extensions on my solo show that I did in February this year called Why So Blue Brown Boy. That collection was quintessentially the birth of this conversation about emotions, vulnerability, masculinity, wanting to speak about societal norms and societal conversations against men and men's mental health, and prove and show that there are ways for men to deal with our emotions in a natural and healthy way as opposed to substance abuse and violence. We can express ourselves through conversation and vulnerability. So these are extensions of my almost vulnerable self, or the most intimate parts of myself being displayed or exhibited.
Being open about your struggles is not a weakness, it is strength. And I'm glad that today we had the opportunity to have this conversation. I hope that I managed to inspire you to open up if you have any challenges. And if someone close to you does open up, don't ridicule them or call them names. Instead, encourage them to seek professional help.